Back again with another video. Today, like I said, we're going to be talking about insurances and pretty much how it all goes. Because one thing we see a lot of, especially out here at CFS at our store, is that we come encounter with a lot of customers who are really confused about what the insurance covers, what they don't cover, what kind of insurance plan do they have. And then when it comes to certain DME stores out there, DME companies, they have a list of different insurances that they bill for, but and it's just a lot of confusion. So we have a lot of customers that come in, and a great scenario is, oh, the doctor gave me a prescription for a wheelchair or a hospital bed, and I have Medicare, I have this kind of insurance, and can I get the item just covered? And a lot of times they are looking for the item to be covered like the same day. So it's basically like, here's the prescription. Can you give me the item I'm looking for? Can you give me the wheelchair or the hospital bed? And then they go on their way. But unfortunately, we tell them no. There's actually a list of steps that has to happen before the insurances actually cover the particular item. So for a lot of times with insurance, it's not just you go to, you give the doctor gives you a prescription, you go to the store, and then you get the item same day. It actually doesn't work like that. What happens is that the prescription is just the step number one of the insurance recognizing, okay, that you need this particular item, but it's a whole nother list of steps that you have to go through for the insurance to actually cover the item. So Tara here today is going to be talking about that because she deals with the insurance directly. And Tara, it's all on you.
Okay, hi everyone. So, in the insurance piece, this is an experience. We're actually what we're going to start doing is trying to just give you guys some feedback on some experiences that we may have daily or periodically to try to give you an idea on if you run into this situation, how you could handle it to save you time and things of that nature. So, for instance, we have a customer, they come in and they have a prescription, and they've been calling for the last 2 days trying to find a supplier that's going to accept the insurance. Okay. So, this particular patient, she's trying to get the information for her parent, for her mom. And so she's been calling around. The mother has Medicare and she has a Medicare card, but traditional Medicare. And so with traditional Medicare, we accept traditional Medicare, but we don't accept a lot of the Advantage plans. And so unfortunately, some families they don't know. And so I would suggest that what you do is that when you get a prescription from the doctor, that you are to call Medicare. If you have Medicare, call Medicare directly. Ask them exactly what insurance your parent have. They'll be able to tell you if it's an Advantage plan or if it's a traditional Medicare. If it's an Advantage plan and you have a particular product, then you're going to call to that Advantage plan that's on the other insurance card because you should have two insurance cards or three. Okay, and so you're going to call that phone number there, and you're going to tell them that you need a provider, a contracted provider that can supply the particular product that the doctor wrote for. Sometimes, depending on what state you are in, of course, the policies and the process is a little bit different. But for here in California, and I know some other states as well, you would call them and they would give you, sometimes you have to go through the IPA or the medical group. Medical group gets the prescription from the doctor. They send it to what's called utilization review. Utilization review reviews the information, see if it's going to be an authorized item, and then they'll send it over to a contracted provider. Unfortunately, the patients they don't know that and their families don't know that. So, we just had a customer yesterday and she was literally calling around for the last 2 days. And so she came in and I felt so bad. And so when I ran the benefits for her, it was an Advantage plan. And so here she is leaving again from our location, again, after calling around and trying to find someone who would take it. And so this information that I'm giving you today hopefully will allow you to be able to stop right there and pause and just know what steps to take before you're calling around, before you're going from one provider to another. And literally, this lady, I think she had said she had called like five different places. And so hopefully this can help you to just figure it out, because I know that time is valuable, especially when you're trying to take care of your loved one. So I hope that this information has helped you today. If you ever find yourself running into problems and you just don't, you're at your wits' end, please go to cfsmedicalequipment.com. You can also contact us at 310-817-5373. We have an app that you can get a lot of great information from, a lot of resources for these processes. So hopefully that's a takeaway today. Again, cfsmedicalequipment.com. Thank you for your time and have a wonderful day.
All right, and there's just one more thing, but before